not
You
showing
can
them.
still do our post in the group one, though. If you want to do that.
We're recording. Rebecca, do you want to read the question still? Yeah.
Sure. Okay, guys. So question 1. What do we know about this condition? Gamekeeper's thumb. Anybody?
I searched that it was also known as skier's thumb, and the game, what it is going on is the UCL, like the collateral ligament in your thumb, is torn or partially torn, and it happens from like falling on an outstretched hand. That's why it's normally called skier's thumb, because whenever they are skiing and they try to brace themselves, they normally fall really hard and either tear it or partially tear it.
That ligament?
Yes.
I read somewhere that it could also be an overuse injury over time.
Mm-hmm.
Okay.
I read that too.
Well, if we're talking about like a ligament tearing, like what do we know about the healing time for a ligament?
It is low. It's not as it's not as vascular. Ligaments are not as vascular. And so the healing time is going to be a lot more prolonged than like it would in somewhere else.
Does it regenerate or does it just repair? I feel like it just repairs.
They do not regenerate.
Right, it just repairs.
Yes, they heal or repair.
So it's going to have scar tissue.
Yeah.
I saw on average it was like about 4 to 6 weeks, depending on like surgery or if you just do like therapy, if it like tore all the way.
Mm-hmm.
I think it depends on that too.
Do people usually get surgery for this injury?
It depends on how severe it is. So if it's completely torn, if the ligament is completely torn, they would probably undergo surgery to repair it. But do y'all I don't really know, what do they do in that surgery? Like, how do they even try?
I would assume
look it up. Let's see. It says that it's most effective. It says the surgeon will rejoin the torn ends of the ligaments back together. If your gamekeeper's thumb has caused a ligament to be torn from the bone, the torn end will be sutured down to the bone itself. That is on an orthopedic specialty hospital website.
Okay. But if a ligament tears, that sounds like right?
Yes, I was reading an article earlier that talked about like women are more prone to ligament tears, and it has something to do with like our hormones, and like during our like menstrual cycle, we're more prone to have like torn ligaments.
I do know that because with our cycles, especially with your hip flexors and all those ligaments, it loosens up. Each month our ligaments loosen and then they'll tighten, loosen, tighten. So like during that period, you are prone to injury. And I only know that because I've dislocated certain things and my back has been all screwed up. It's every month.
Isn't that crazy?
It is.
Cool. Sounds awful.
So pain, there's inflammation. You think there's like bruising?
What I found says that like for the first 6 weeks, there's like a lot of pain, weakness, and stiffness.
Okay.
So we know that like ligament, like healing time with ligaments is, like Grace said, anytime from like for 4 to 6 weeks. And you go through all the stages: inflammatory, proliferative, remodel, repair. But we know that ligaments don't regenerate. They're only going to repair. So there's going to be, I guess, like probably a
Tender
lot.
bruising.
Yeah. Mm-hmm.
Okay, we know that there's weakness, probably especially when you're trying to do any sort of pinch.
Yes.
That's what I was about to say. I just read an article, like the abstract or whatever. It said pinching. That's when like the most severe pain happens.
Mm-hmm.
Okay.
Especially if it's like a partial tear and you don't get surgery to fix it. There's a lot of pain.
Right. So like if you did not get surgery to fix it and it was like partial, I would just assume a lot of rest. Like you could not, and like splinting, I feel like is going to be beneficial for it. If you get surgery and if you don't get surgery, I feel like you're going to need to be splinted somehow to like control inflammation and like pain and management like that. Because I also read, like talking about the pinching, it's like an athletic injury because a lot of people who like hold a baseball or hold a tennis racket, like the overuse of like using a tennis racket like that could also cause this injury.
Okay. So if you're talking about splinting, does anybody know, like, just even though we don't really know about a lot of different orthotics, we're learning about them right now, but what type would y'all even think would help?
I looked up just generic ones for the partial tears, and it said you can either cast it or I don't know how to pronounce it, but it's the SPICA splint. Spica. I don't know.
Spica?
It was in our book. It was in our reading, but that's what I'm looking at. 2 different articles pulled up, and they both say that they use those for immobilization of the joint.
Mm-hmm.
Can you describe that for me? What does it look like?
I have no idea what it looks like.
I can show y'all a picture of it.
Yeah.
Let me show y'all this really quick.
Pretty much just a thumb immobilization splint, right?
Yeah,
Yeah.
literally.
It just kind of holds it like.
Mm-hmm. The picture I'm looking at, it goes from like, it's it starts from like past your wrist and it's here and it doesn't immobilize your metacarpal. So it stops about here and it covers your entire thumb up to like your PIP. Yes.
If they're experiencing like weakness and stiffness, and this may have just been what you said, but like, are we going to want them to be able to move their thumb to mobilize it to kind of like maybe work away some of the stiffness? I don't know. And like, since it's not vascular, I feel like moving it's probably important, but that could be wrong.
Did you say if you're doing stuff, take the thing off?
Yes.
Well, I'm just saying, like, in general, like, you know how we talked about, like, there's different purposes, like immobilize, torque. I can't remember the other one.
Resistance or resistive?
Yes, I think you're right, Cassie. I don't know. I guess I think when he asks what would be the purpose, I think that he's looking for one of those.
Everything I read said if it's partial, you don't want to mobilize it. You want to immobilize it because you want that ligament to stay in place for it to heal itself. Like if you're constantly moving it, it won't like reheal.
That's what I read too, Alex.
Yeah.
Now, if it's surgery repaired, like surgically repaired, I don't know. I didn't read that. But if it's partial and you don't have surgery, you don't want to move it at all.
For like surgery, what I read was that it said following surgery, patients will be placed in a cast for 4 to 6 weeks to protect the repaired ligament. At that point, gentle motion of the finger will begin. So I guess after 4 weeks, gentle motion will begin. So either way, like, especially like you said, if it was partially torn, you would want to immobilize it or it could continue to tear. I feel like you'd want to rest it. So it's just like an overuse, like strain. But if you had surgery, I feel like for sure they would have to, like, either way, it needs to be protected from like any overuse of it or like abrupt use, I would say. So yeah, for both things, it says that you're placed in like a thumb spica splint for 4 to 6 weeks. I think actually the thumb splint would be if it's partial, and then you would get casted after surgery. That's the way that I'm reading it on here.
That's the way I read this too, yeah.
The last little thing on the discussion says form follows function. If you know the function, what would the form look like? And we kind of discussed that, right?
What does that question mean?
I was about to say, what?
I think we were just at first it was just like which orthotic would help, and we mentioned that. What's the purpose of the orthotic? Immobilization, and form follows function. So what would it look like? So if you're trying to immobilize that specific area, it would form around your thumb, and just like you said, I think we've kind of went through it all.
Is that kind of like when he was talking about how like you almost never splint or cast anything that doesn't need to be? Is that kind of what he means? Like you really just want to like,
Oh yeah,
like keep it
Yeah.
just in that. I don't know if that's what you mean.
I think so, because I don't think you want to weaken those other
Right.
muscles. You just want to immobilize so that ligament can heal. Hopefully they're taking some pain medicine, icing too. But did anybody else have anything more to add to this, just to start off? For
You know how we talked about the forearm trough, and then it also talked about the thumb trough? And I remember reading, I think it was like half the circumference of the thumb for the trough. I don't know if that's important right now, but I just remember reading when we were talking about forearm circumference and length that
there we go.
the thumb is also supposed to have a half circumference
So
for
it's
the
not
trough.
coming up. Yeah, that was great. I totally forgot about that. And then did he say 2/3 of the?
Is it?
A different thing?
I know that when it's on the forearm, it's 2/3 length, but I'm not sure when it comes to the thumb.
Yeah, I wouldn't think you would need to involve the forearm at all for this one.
Okay.
'Cause, like you're saying, that would weaken those muscles.
Yeah, because they wouldn't really have much wrist function if we did that.
I think we kind of covered everything, guys. Anybody else?
That's good.